Now, as we've said from the start, standard hormone labs were designed to capture a stable value. And perimenopause, by definition, is anything but stable. That means your experience and your symptoms are the most valuable data we have during that time. Hear me again. Your experience, your symptoms, what's happening to you, what you have documented, what you know as yourself. Those are the important factors you want to bring to the office because perimenopause is a clinical diagnosis, and that makes it our whole job to listen to you. It's not diagnosed by a lab value crossing a certain threshold. You cannot expect to apply the same tools across different fundamental biological contexts and get complete correct results. That's not a failure of your doctor's knowledge, and it is definitely not your body not coordinating and cooperating. It's simply the instrument is limited in that way. We know the single dot is not telling us the whole story of how you are feeling. This is the reality of perimenopause, and it's exactly why it's so important to go into your clinical appointment self-aware and prepared. Know which labs you had, when they were drawn, and where you were in your cycle. Be prepared to start the conversation. Don't wait for the lab results and the question from your physician. Don't worry, we'll send you the slide deck after we're done. It has the specific questions written down, just the ones we talked about are the great ask your doctor moments. And we'll also send you an exclusive 20% off discount code you can use on Self40 to learn more about everything we've discussed today. So you're equipped to get the care you need and that you deserve. So a little bit more ask your doctor moments. Of course, we're here for that. The first one is, what are you looking for to figure out if this is perimenopause? My symptoms, my cycle history, labs, or some combination of it. Next, how does my symptom and cycle history factor comparable to the lab results? Another one, if labs aren't going to change how we approach things, is it still worth doing? Why or why not? And then finally, what's the most useful thing I can track or bring to our next appointment if a single lab value isn't the full picture? So understanding what these hormones are doing and why timing changes what a number means isn't about becoming your own doctor. It's about walking into the room able to ask sharp questions and advocate for the care you deserve. We started with a promise that you would know what you're experiencing and that it's normal. That is nothing to be ashamed of, and there are actions that can be taken. So here's the easy button for you. At Self40, we have 2 courses built for this exact reason. There's Menopause Essentials, which covers 5 foundational lessons on your brain, your heart, and your body. And then the whole enchilada, I like to call it, is Menopause Explained. It's a 13-module program. It also includes information on hormonal and non-hormonal therapies, as well as bone health. Both are built from the real conversations I had in the clinic for years, answering the questions you've been asking and some that you didn't even realize you were ready to voice yet. Because you've prioritized yourself today, you've shown you want to, or at least know you need to, care for yourself. We appreciate you and want to support you. So use the code Self40Labs to go deeper into symptoms and subjects that impact your life. Don't worry, we'll also send you an email with a link in the codes.